The only issue is that if you're on medicines, you can't stop. If you are, medicines get potentiated on a fast, and they work more powerfully. And that can be dangerous. If you're on blood pressure pills, it'll drop your blood pressure too low. If
Why is that? Why do they get more powerful?
Right. Oh, well, a little more science here. There's various theories, but the most likely is that when you take a medicine, a vitamin, a supplement, anything, the molecules that you're taking do not float freely in the blood. They are immediately bound to a carrier protein like albumin or globulin. And most of these substances, medications as well, travel through the body bound to these carrier proteins. And only 1% in general will leap off their carrier molecule, do their effect, and come back on. This is just the pharmacokinetics of medications, et cetera. Well, ketones in your blood, they're slightly acidic. The blood doesn't ever turn acid; it's always alkaline, but it's a little one notch to the acid side in your bloodstream. Well, that's enough to change the binding characteristics of the proteins there, so things don't bind so tight. And instead of 1% free drug, now you got 3% free drug, 5% free drug in your bloodstream that are active. And we've learned the hard way. The medications that lower blood sugar, who don't do a water fast while you're taking metformin or glipizide, blood sugars drop too low. Don't do a water fast on beta blockers or ACE inhibitors. You'll drop your blood pressure too low. So in general, again, this is why you need medical supervision for longer fasts. But if you can, stop all medications for a day or two. Most people aren't going to get in any trouble with that. But if you're on medicines, you can't stop. If you are on prednisone, you're on a psychiatric drug, you're an SSRI, and it's not safe to stop it, then you don't do a water fast. What you do is a juice cleanse, a nice glass of green vegetable juice with a little bit of carrot or apple in there so it doesn't taste like lawn clippings. That's a lovely thing to do for a day. Just sip green juices all day. You'll get most of the benefit of a water fast with that, but you don't have to stop the medications. You don't go into ketosis. It's a safer thing to do. So folks who are on medicines they can't stop, they should do a juice cleanse. And I use the word cleanse. It's not really a fast because they don't go into ketosis. It's a 600-calorie liquid diet, really. But it's so good. It's such a cleansing thing to do. A day or two on juices is a wonderful thing, and most everybody can do that safely. So that's how we play that one out.